and are not controlled with things like OxyContin. Now this stuff's gold as far as the addicts go. Our good friends over at Insys did a great job marketing this, and it didn't matter if they lied. They did whatever they could to get this drug in the hands of people. Why? It's expensive. If people had to pay for this stuff themselves, they probably wouldn't get it, even though they really, really like the stuff. So what Insys did is they operated the IRC, or the Insys Reimbursement Center, which will help doctors and patients secure prior authorization from those nasty insurance companies that tend to ask questions of why you're getting 1,000 pills every month from 2 different doctors to get reimbursement for this drug for patients with advanced cancer. Dirty little secret number 1 in this part of the show, and that is a lot of drug companies operate these reimbursement centers. And the way they work is the employees are incentivized to lie in order to get a prior authorization approved, and management looks the other way and has no process in place to detect whether people are lying. I've seen this firsthand with growth hormone. Growth hormone is not approved for muscular dystrophy, but a doctor prescribed it for that because there's some research to show that maybe some people are helped by it, but it's not something that's generally approved for muscular dystrophy. Nevertheless, one of these reimbursement centers, not Insys, another one that shall remain nameless, changed the diagnosis on the prior auth form from muscular dystrophy to growth hormone deficiency. And I saw it in my own eyes. And there's dirty secret number 2. And dirty secret number 2 is audits are useless to detect this sort of thing. When I saw that, I worked for audits and investigations in the state. And guess what? Because nobody else really understands how this market works, nobody was concerned. They didn't understand it, so they never went after it. They never audited it. The same thing happened here with Insys. We can read about how Insys was audited by the Compliance Implementation Services, which is a firm that was subsequently acquired by Deloitte, and they found no major violation in the company's policy or guidance to employees. They did note that the policies were non-existent, but they found no violations of the non-existent policies. Folks, remember, Enron was always audited. Dirty little secret number 1, drug companies have reimbursement centers where they lie to insurance companies. Dirty secret number 2 is that audits are helpless to detect this sort of gaming. The actual case that's cited in the paper today is someone was prescribed Subsys for back pain. But because A, it's expensive, don't get me wrong, insurance companies are motivated by cost. They don't do this same sort of prior auth for cheap narcotics. Some of them are now because of the abuse, because of the opioid epidemic. They're starting to track people. This person's drug company called their PBM to get approval for the prescription. Person works for the drug company. They say they're calling from the patient's doctor's office, and they give the doctor's national physician number so that the insurance company thinks they're really talking to somebody from the doctor's office. The person at the insurance company, they got this PBM, they've got this screen, and they say, is this for cancer pain? Because it's only indicated for breakthrough cancer pain for people that are not helped by a longer-lasting narcotic. They got to take this fast-acting, short-acting stuff for that brief episode of breakthrough pain. So the insurance company says, is this for cancer pain? The drug company employee says there's no code for breakthrough cancer pain. Well, that may be true, but it has nothing to do with what this patient has. So the insurance company says, well, if it's for breakthrough pain, yeah. Unfortunately for Insys, the woman subsequently died from an overdose of Subsys. So you run a reimbursement center and lie to everybody about growth hormone. What does it do? I don't know. Maybe it helps a kid with muscular dystrophy. Maybe it actually helps him. Jacks up the cost of health care, no doubt. Probably makes it harder for people with real growth hormone deficiency to get growth hormone. But this is much worse. This is killing people, ruining their lives, creating addicts. And at the very least, I will bet you that the next time you break your arm or have serious surgery, you're going to have more difficulty getting adequate pain control. because of what these drug companies have done. By the way, the reaction from INSIS is 90% of us are gone. We did nothing wrong. We're never going to do it again. Unfortunately for them, Elizabeth Guerreri, the former head of their reimbursement center, pled guilty to wire fraud conspiracy and is cooperating. Their former CEO, Michael Babich, has been charged and he's pleaded not guilty to racketeering, mail fraud, kickbacks. So this is still an open issue. Will people be held personally accountable for their miscreant behavior under a corporate umbrella? Or is the corporate umbrella so broad that people can do any horrible things as an individual and get rich and not face serious consequences? Are these government-sanctioned drug dealers ruining our society or not? Should these people be held to a standard of care, to a duty not to inflict harm on individuals and society? Will justice be done? Ultimately, it will. I like to keep the show clean, but let's paraphrase. God severely judge the pusher man. Legal or not? Until next time, my friends, stay healthy.
Be sure and subscribe to our podcast on iTunes and more details at grumpyolddoc.com.